I'm Marc Nevins, and I'm pleased to present guided implant surgery for the posterior mandible using the Marc Nevins implant system, the implant for the GP. Our patient presents with the need to replace the mandibular left second molar and the mandibular right first and second molars. Our cone beam CT scan has been utilized combined with a diagnostic wax-up to plan the implant placement. We can see that given the contours of the alveolar process that it will be beneficial to have a surgical guide for the implant placement, and this has been fabricated with stereolithic technology. We will make the initial pilot holes through the guide and through the soft tissue on the mandibular left second molar region, which is very difficult to access and has adequate attached gingiva, whereas on the mandibular right molar region, where there is more limited keratinized tissue that is sitting mainly over the ridge, we'll make a buccal flap prior to beginning to prepare the implant sites. A pilot drill is utilized at a 2 mm diameter. The front site is prepared to an 11.5 mm depth, and the distal site is going to be a 10 mm depth preparation. Once the pilot drills have been established, these will be reinforced with the 2 mm twist drill from the surgical kit. The Marc Nevins implant system has an extremely simplified surgical kit, which is demonstrated here. It's based on multi-drill technology, and our multi-drills are developed where each drill could go directly from the 2 mm twist drill to your final multi-drill of choice. These are highly engineered drills that match very precisely to our dental implants, and you'll find a unique experience when you're able to actually use these. The implant sites are continued to be prepared here, first using the number 2 multi-drill. We can see going to the 10 mm depth on the second molar implant site, and the first molar site is going to 11.5 millimeters. The next drill is the number 3 multi-drill, again going to the same depths, 10 millimeters and 11.5 millimeters. The piezo instrumentation is used here to flatten the ridge where it is uneven, and then the drilling is continued again with the number 3 multi-drill. And you can see the lines are extremely easy to see on these drills, and also how easily the drills cut the alveolar bone. Now we're using the final drill, the number 4, and we can see going to the full depth here at 10 millimeters. And the forward site would be 11.5 millimeters, which is that next thin line between the two thick black lines. Now the implants are being placed. These are being placed at 15 RPMs at 45 Newton centimeters. And you'll notice the implants cut very easily through the bone, but they lock into place with a high primary stability when they get to depth. This is a combination of the geometric design of the tapered implant as well as the thread design, which has a sharp self-tapping thread design which cuts easily through the bone, so there's not much bone compression, but there's a very high initial stability. You can see here as that's being torqued into place how stable the fixture is. Once the fixtures are in place, cover screws will be placed. I like to tighten the cover screws to 15 Newton centimeters so we don't have instances of loosening of cover screws or healing abutments if you prefer a single stage procedure using healing abutments. The flap here is closed with chroma gut sutures. And then we return to the left side. We'd already made the pilot hole through the soft tissues. Now we're going with the 2 mm twist drill, and this site's going to go to 11.5 millimeters depth. Again, that's going to be the thin line between the two thicker black lines. We want that first drilling at the 2 millimeters to be to the full depth of where you're choosing the countersink at the top of the implant, and we can see here that thin black line is at the buccal bone level, which is lower than the lingual bone level because we want the implant to be completely in bone. And here we're going directly to the number 4 multi-drill, skipping the previous one. As I mentioned before, this is fine to do with these drills. They cut very easily, going right to the 11.5 millimeter depth. And then we're going to go ahead and place our 4.2 by 11.5 millimeter fixture. What's interesting is you'll see how the blood is easily attracted to the sandblasted acid-etched implant surface, and this is very important for establishing the fibrin clot on the titanium, which is important to our healing. So the advantages here include the high primary stability as well as the excellent surface technology that's going to attract that blood clot, and it's going to lead to faster healing. The implant is torqued into place, And then a cover screw is going to be placed here, and this flap will be sutured as well. Again, you can see the nice stability. Cover screws being placed with the motor, again 15 Newton centimeters. And then the flap's going to be closed. In the post-operative radiographs, we can see the fixtures. They're all 4.2 millimeter diameter and 11.5 on the left side, 11.5 and 10 on the right side. Little Implant Company looks forward to sharing more surgical videos with you in the future.